Hi, in this short video, I'll be doing a sharing on using nudge interventions to mitigate medication errors. As a background, traditionally, we always thought of behavioral change, either in terms of policies change or interventions in healthcare, has always been focused on providing new information or seeking to change the way people consciously think about their behavior with the assumption that people change their behavior accordingly when their motivations as well as their intentions are changed. However, we know that most of the time, intention does not always equate implementation. A substantial proportion of the variance in behavior cannot be explained by just changing of the interventions intentions alone. In fact, it's been shown that changing intentions would account for less than one third of the variance of behavioral change, because we know that people, uh, in many occasions, they may not act rationally. They may use shortcuts, they use heuristics, they use the rules of thumbs. And so, what is nudge? Nudge comes from the concept described in this book by Taylor and Sunstein, also called nudge. It is defined as a range of interventions that although may differ in scope and design, but have in common the aim to gently steer a choice so that the keyword here is to gently steer a choice without forbidding the alternative options. Nudge should be low cost, and importantly, it should be unobtrusive. It shouldn't be uh, too intrusive, too obtrusive to be implemented. The whole idea is about changing the environment and the context where decision making are being made. In other words, is the term that's been always been used is known as choice architecture. You design your choice, uh, you um, manipulate the choice or the context in order to make it easier for people to do the right thing and more difficult to do the wrong thing. A, a, a sort of uh, funny example that's given in Taylor and Sunstein's book is about the printing of a fly in the male toilet bowl, where for a man to pee uh, and aim at the fly to reduce the risk of spilling over into the toilet bowl. Here's a good paper on the concept of nudge, the theory and practice of nudging, changing health behavior. So this is about using nudge interventions in the healthcare setting. Another good paper by Dolan et al. Influencing behavior the mind space way. So in this paper, they uh, design nudge in using an acronym known as Mindspace, but we're not going to go through this today. So a good example of nudge using the example in this paper, the Mindspace framework is known as priming. We know that uh, the store of selling some cookies, they will tell you that there is the availability of free smells, So free smell is one sort of priming or activation of some sort of knowledge or memories to make it more accessible and therefore more influential in processing new information. With the assumption that people will change, people behave differently if they're being primed by certain cues beforehand, been primed by certain sensory stimulations. For example, many things can act as primes, the words, the sight, the smells, and even things like exposing people to words such as fit, lean, active, athletic may make them more likely to use the stairs rather than using the elevators. Another good example of priming as a strategy to induce nudge is by placing a life-size cardboard cut out of a policeman or a security guard to reduce the risk of crime, of stealing. So it's about deliberately placing certain objects in one's context, one's environment to alter the behavior. This is not also known as a situational cues. Even things like walking shoes or runner's magazine being placed in a location that is easier to be visible will prime a healthy lifestyles in people. And also, they're talking about the amount of food that people serve and consume will actually depends on the size of the plate. If you serve the same amount of food in a very large plate, that may prime people to think that the amount of food is not enough for them, and they would have a tendency to eat more as compared to if you serve them in a smaller plate. Or by placing posters of eyes on above an honesty box where people can uh, where people can see that it will induce you to make a donation for the coffee or the tea that they make, or to prime by placing certain items in the shopping mall at an eye level to induce people to buy. In the context of prescribing antibiotics, such interventions has um, is described in this paper by Yadav et al. It's a good paper in 2019. Um, so according to Yadav et al., there are a number of interventions or nudge strategies that can be utilized to induce people for good or doctors for good prescribing habits. One is by providing provider education through regular educational interventions, through regular education presentations to highlight the important points from the latest guidelines to prime doctors and nurses for good antibiotic prescribing practices. Or the patient education by to prime the patients for certain um, expectations, for example, by using pamphlets, posters with messages suggest that from the CDC, antibiotics aren't always the answers to be displayed on the wall of the emergency department that will prime patients so as not to always expect antibiotics from the doctors and to relieve the doctors from the pressure of unnecessary prescribing antibiotics to the patients. And the other one is to ask the providers to make a commitment. For example, you may ask them to sign a commitment letters to pledge as pledges to practice good antibiotics stewardship. So these pledges can be displayed in the consultation room, in the treatment room, to say that I'm committed to good prescribing habits. Or we get somebody to be a provider champion, either the internal medicine specialists, the emergency physicians, or the infectious disease specialists. We're getting experts or champions, even microbiologists, the top hospital top management to always regularly issue reminders, messages through emails, instant messaging applications, WhatsApp, or even letter posters to lead to good antibiotic stewardship. Departmental feedback would give regular, such as monthly departmental audit or feedback. We can display it in graphs, such as the rate of inappropriate antibiotics use, bad prescribing habits, microbial resistant pattern, or even we can actually categorize them according to different zones. For example, the rate of inappropriate antibiotic use in the green zone, the yellow, or in the red zone of the emergency department. Or we can do some kind of peer comparisons by sending out personalized performance ranking, um, reports delivered through emails, letters, so that each individuals, doctors, or healthcare staff in each department, each unit know how well they are doing compared to their staff or compared to their peers. So doctors of the teams who perform well may even be given some kind of rewards, top performers, team of the month award, and so on and so forth. So this is just a short sharing on using nudge interventions in the context of prescribing, especially in the context of antibiotic prescription.